Welcome to Conversations in the Clinic. Today I'm joined by Dr. Meghan Ronco-Forsatz of Sauna Spine and Physical Therapy. Meghan, thank you for being here with me.
Thank you for having me.
So we'll get right into it. You've walked the scoliosis journey yourself. How did your personal experience shape the way that you got into the profession and work with your patients now?
I think like a lot of physical therapists, I was introduced to PT as an adolescent where it was very impressionable and seemed like such a fun field. So having scoliosis, I did the Alexander technique and several different techniques when I was younger and just felt like physical therapy was the best fit for what I had. And then now doing traditional physical therapy as well as Schroth based, I feel like I can relate to my patients a lot.
Yeah.
And it helps, especially the adolescent patients have a hard time with having anything that's needs medical attention. So it's good to know where they're coming from.
Yeah. Is that about when you got your diagnosis, like adolescent age?
It's actually hard to remember, believe it
Yeah.
or not, I tell them, but I want to say it was probably 12, 13. Yeah.
Yeah. Um, that's huge, right? Of like just having been there,
Yeah.
you can just be empathetic towards that. And I bet you can put some parents at ease because you've been through it too, and you know what their kid is now going through.
Yes, I could say I remember arguing with my parents saying, I don't want to wear my brace tonight, that type of thing, because it's very difficult. So, yes, at least it makes them feel a little bit better, I think.
Yeah. Oh, absolutely. Um, so for those who aren't familiar, we can talk more about this, but kind of go through like the what is the Schroth method and how does it help people with scoliosis and what makes it different from seeing someone who's not necessarily specialized in seeing people with scoliosis.
And it mainly addresses the spine, and the spine will deform in three different dimensions. So it'll obviously bend side to side and also rotate, and then it may hyperflex or hypoflex. So the goal is to get to as close to a neutral posture and position that you can. And position, we use these things called race bags and things to put someone in the proper alignment and then cue the muscles to expand into that position and then strengthen them to hold the spine, hopefully, in a position like that, in all incorporating all three of those planes of motion that you want to correct. It's very cool in the adolescence because you can actually see the spine straighten out. And then they have to obviously hold it there, but it is very, very cool. And it's been in Europe for so much longer than in the US. And here since 2005 has it kind of been gaining popularity, but in Europe, the Katarina Schroth developed it in the 1920s. So it's getting more well known, which is good.
Yeah, it's gaining traction. I remember I graduated in 2016 and kind of had started to hear about it, and patients would call the clinics I was working at asking, "Do you have a Schroth certified
Mhm.
PT?" And it's we could nerd out about anatomy and that kind of stuff, but I think can you dive a little bit more into how important, and I'm nerding out on this every day, how
Mhm.
important the spine is for everything else.
Oh my goodness, yeah, and that's my like fun, especially in the adult patients,
Yeah,
because the way the spine rotates, the pelvis is so intimately connected. And then if you're out of alignment in the sagittal plane or like too bent forward or too straight, that causes immense pain. So just a small tweak of, especially the rotation component that happens with scoliosis, causes so much dysfunction and so much pain. So the adult patients do great just by trying to, even though you can't fully correct a spine, you can ease some of those forces and affect the hips and the knees and everything. Yeah.
yeah. Again, I know about this, but listeners might not. Why can't you necessarily correct an adult spine, but you can make a change in an adolescent spine?
The adults, the spines are more rigid, essentially. So, and we have more arthritic changes. So there's a lot of other components going on to that. You can definitely change a curve to a small amount in adult. You can change posture for sure and muscle play, but we're definitely not as pliable as adolescents anymore.
Yep. I love here and there. I'll get a kid in here, and I love treating a kid because number one, it's fun,
Yeah.
and number two, they get better fast.
Yes, yes.
They get better fast, and it's cool to be able to see such a difference for them. So again, I love the anatomy of it. I love I would say like your body responds to the demand that you put on it, and so that's part of being an adult is you just had more opportunities to put demand on it in good or bad directions. But it's cool to be able to jump in and catch it on an 11 or a 12 or a 13-year-old and really make a visible change for them
And
that that affects them literally for the rest of their life and in
yes.
you know what sports they can play and you catch them at 75 playing pickleball because they fixed their problem when they were a teenager. So that's awesome.
Yeah, and it's cool when they realize that because most adolescents don't have pain and they might not realize the importance of it. But I do have a few higher level athletes. I've had one very competitive football player. Had a very competitive dancer, and she would film herself on point doing her Schroth corrections and not doing her Schroth corrections. And with her Schroth corrections, you would see just her feet. She could actually get fully on point, and without them, she couldn't. So just that alignment made a huge difference. Yeah.
That's really cool.
Yeah.
Yeah, and totally helps with I guess I need to do this.
Yeah, exactly.
The buy-in there. That's great. So what are some like common misconceptions about scoliosis?
I think the number one, especially in the adult population, is people think that they just got it as an adult and they're 50 years old and they say, I was carrying my bag this way. It must have caused my scoliosis. And truthfully, most people carrying a bag, lifting a kid on one side, it's not going to cause scoliosis. It's more hereditary. It's more genetic. It's going to happen no matter what you did. And most people think they did something to cause it. Um, you can, of course, once you have a scoliosis, if you're always falling into the curve, you can maybe progress it versus not. But for it to have started, people think they did something and there's nothing that would have caused it.
That's got to make them feel better when they're sitting on your treatment table going, well, I guess
Really?
I didn't.
Yeah.
Um, yeah, that's so I'm curious. This is more of a clinical question, and I don't even know if you would know the answer. Historically, like, is scoliosis a recent development, or were there, did we have great, to the 10th degree grandparents who were walking around with scoliotic curves, or is that more recent?
I'm pretty sure has probably always been around hereditary wise, because there's always been like hyperkyphotic people as well in society and things. So I think it's just so much more researched and studied, and in school and then pediatricians now test for it more. So I find my population of, I would say 60-year-olds is about when it starts, where people had no idea they had it. So
Interesting.
it's been there forever.
When did they start screening it in schools?
I don't actually know the actual time frame, but I want to say it's probably in the 80s,
Yeah,
maybe
I'd be curious. We'll
90s,
have to
if I
look that
had
up
to.
and
Yeah, good
and post
question.
it because that would be an interesting kind of graph to look at.
Yeah,
People who were aware of it and when they started to screen for it in schools, and then being able to intervene on it in a productive way, um, right? And I'd be curious too of like add in okay, Schroth approved in 2005, and then what happens to it?
true, true.
That'd be a fun again getting nerdy on here, but that would be a fun thing to look at. Um, so we can talk certainly more about the other things that you treat, but kind of staying on our scoliosis kick, like what advice would you give someone who's just been diagnosed with it?
Probably keep calm because it is a long process. If it's an adolescent, obviously would be the one that would be most diagnosed recently, is to probably, if it's a large curve, get more than one opinion from a medical professional, and then just kind of take a breath and know that it's going to be a little bit of a long journey. There's a great website. I don't know the woman personally, but it's called Higgy Bears. And she herself, I believe, had a scoliosis, and she set up this site where there's a lot of Zooms there's different Zooms. There's ones for the parents, Zooms for teens, Zooms for kids.
Yeah.
And I think to find a group, someone to feel comfortable with, whether or not you just put your camera on your microphone on mute and show yourself on camera and you just listen, is helpful.
Yeah. To like find a community.
Yes.
And know that you're not alone, because that can be, I would imagine that feels really isolating.
Yeah.
Um, so that's awesome. That's helpful. Um, you kind of mentioned your dancer, but do you have any other like success stories that have stuck out for you, whether it was scoliosis or anything else that you've treated?
I mean, through the years, yeah, that was just a cool one with scoliosis. I have a swimmer now too that she is done growing and didn't really need to do physical therapy, but she says she just feels so much more centered and balanced when she does it, and she's cut off a couple of seconds on her time um through those things. So scoliosis related that way is great. So there's so many people that have avoided surgery, that young kids that
Yeah.
were on borderline and they really stuck with their program and avoided surgery that way.
Yeah. Do you mentioned kind of keeping people motivated and compliant with home exercises. Is that like a threat that you use? Like it's this or surgery, which is not, it's valid.
No, I try not to scare people,
Yeah.
but it is hard because certain populations don't want to do exercises as much if you're not a very athletic person and you don't
Yeah.
understand the reason. You really just have to try to get them on board as best as you can. Talking to other people that are in the same boat is helpful. But I try not to threaten that per se, because then people will, I've had kids just say, I just want to get surgery. Why am I going to do any of this up?
Yeah. Yeah. It could backfire fast.
So yeah.
Yeah. Especially when your first step there was like, stay calm.
Yeah.
I love, I love,
Yeah, that would
and
be,
I'm in that ballpark too of like, all
yeah.
right, it's a process. It's not a death sentence, but it's going to be a process here. And,
Yeah.
you got to find the right people to help you through it. Um, so tell me about like your influences. I mean, obviously Katerina Schroth, but who else kind of clinically have you followed and who you're learning from?
I love the Institute of Physical Art, and Vicky and Greg that founded that facility. They're all about functional manual therapy and finding the efficient state to be in, where you think of yourself as like sets of blocks and you're vertically stacked right on top of each other, and that's how the core is most efficient to fire and just be in a good position for anything you do in life. And I worked in New York City for many years in just a very busy but a half-hour treat, so not crazy clinic, where we learned a lot of manual skills. So I love the functional manual therapy component, and that's what I based a lot of my treatment on. Seth Blees like works for them. He's like a really well known in core first activities and for very professional. He's worked with a lot of professional athletes.
Yeah.
Kevin Wilkes courses are great too. And Brian Mulligan is, I use a lot of like mobilization with movement, that type of stuff too.
Yeah. Yeah. Um, yeah. I love that. I always like to kind of grill other clinicians of like, hey, who do I not know about
Yeah,
to get into?
and same back to you then, anything that you really like that.
Yeah. I'm like a Kelly Starrett kind of disciple. Not so much in the CrossFit world, but like this whole idea of treating the human first. Right? Of like, hey, yes, let's look at your movement patterns, but let's also ask you like, how are you sleeping and what's your stress like and what are you
Mhm.
putting in your body and who are you hanging out with? And um yeah, I've kind of taken a liking to him. And then same with like Mike Boyle, right? And like more of the strength and conditioning side of things. Um, and just I don't think you can isolate a shoulder or a
Yeah.
knee or a back. Or, like it's we work with people and people have a lot of stuff going on and they happen to also have pain or an issue that they need us to help fix. Um, so yeah, I'll be curious. We'll talk off the recording about like we'll get all nerdy on that stuff.
Yeah.
Um, so kind of in all of this realm, like how do you practice what you preach? Like what's one thing that you do that you wish almost everybody in the whole world would do?
Probably stay calm if I have a little injury and a tweak. I do. I immediate and probably if something's tweaked, I immediately try and do one particular exercise. I don't ignore it, and I actually try to be good and then get something treated right away instead of waiting on something to become a bigger issue. I try to be pretty good at that.
Uh, that's powerful.
I try.
Tell me about it. I'm in the same boat of like, there are some things that I'm like, it'll probably just go away and it won't.
Yeah, at
But
home I'm always like if something hurts, I'm like, I'm gonna mobilize this as best as I can.
yeah,
And then my 4-year-old comes over and jumps on me. So,
yeah, right, right. A different technique. That's
yeah.
a thrust, if you
Yeah.
will. I think that's hugely important because I'm sure you say probably a lot of the same things every single day, and that's part of what I want this platform to be is like, hey, if everyone knew this, it might not be great for business, right?
Yeah.
But it's great for the whole world, that we can help people before they have to come see us. Um, so I love that. I love that you kind of stay calm and try to fix it early. Um, so if well, tell me about other conditions that you treat before we kind of wrap up here and talk about working a little closer with you. We talked a ton about scoliosis, but other things that you see or treat that you like to treat, um, that you would want to talk about?
Yeah, I've traditional PT for a long time before I also got certified in Schroth. So I love recreational athletes. We worked with a lot of them in the city, people that would train for the Olympics and people that played on US Open. And so that population, Achilles repairs and foot and ankle or something sort of near and dear to me. I love the Institute of Physical Arts dynamic foot and ankle course and their rehab for that foot and ankle. It's so intricate and so more complicated, I guess, than I realized when I was a new clinician. That I love treating like lower body and putting everything together. Maybe your coccyx is rotated and that's throwing everything off. I had a hamstring strain recently, and we saw her like once or twice, and she was a smidge better, but something I forget what she said stuck in my head, and I said, "Did you fall on your tailbone like at some point?" And we mobilized. The coccyx was side bent, and then immediately stood off the table and bent. And she was like, "It's so much better." Um, so I like obviously the spine. I treat a lot of in the neck, but I actually do really love like the whole chain, like hip, foot, and ankle for is just really interesting to me.
Yeah, we touched on it. It's all connected,
Yes,
and I love like my own foot and ankle cases because there's so much that goes on in such a little space down there, and it's the foundation for
yes.
and it's always hard. I always said to my husband and I we got engaged in Greece. And I'll tell you that story
Sure.
another time. But there were people, tourists walking around, and inevitably somebody's in a cast and somebody's in a walking boot. And he's like, oh, he looked at the person in the cast. He said, ah, poor person. I said, no, it's worse to be in a boot. Way worse to have a lower body injury because you're not. It affects so much functionally.
Froze everything. Yeah.
Yeah, and it's incredible when you get someone who does look at the whole body, and just like you said, they come in for 1 or 2 visits, and you're still scratching your head, and something's up, and you can do one little thing and make a huge difference for someone. That's awesome. Really cool that you kind of have a Swiss Army knife
Yeah.
in your clinic. That's great. Um, okay, if someone were to want to start working with you this week or next week, what would that look like? What's the best way for them to get in touch with you and walk us through kind of the onboarding?
Yeah, someone can definitely call the clinic. We have on our website too, there's a information inquiry submit form, so we can get in touch that way. But I have another therapist here too, so we still have availability for new patients. And then we run insurance, we'll check that for everybody, and we usually take the information and hopefully call the insurance that day and get back to the person and go from there.
Nice. Are you in network?
We do an hour-long sessions with not just scoliosis, so everyone, so we are out of network, but I do accept Medicare.
Okay. Again, good for people to know and
Yeah,
so many options for folks. And I like to say, like, go to an out of network provider for a better experience. And you're probably gonna get better faster. And you're definitely gonna have a better experience than depends on what you're looking for, but a better
yeah.
experience for sure. Um,
Especially if you've been PT elsewhere and thought that you didn't get enough individualized care, then yes, you're
yeah,
probably right.
yeah. Oh no doubt about it. Um, okay, cool. Is there anything you want to leave us with that we haven't talked about or covered yet?
I think you did a great job being well-rounded with it.
You did a great job.
Yeah.
I helped. I tell my patients that
Yeah,
all the time. You did the work. I helped.
I know. Yeah, owning your own business and promoting everything is hard work, but it's fun.
Yeah. And you've been on Bloomfield Avenue for how long?
This one, I believe about 3 years.
Okay.
Before that, I started in Parsippany and out of a friend's personal training studio and then moved closer to home and for the storefront. So
Yeah. Yeah, I love it.
yeah,
Yeah, you have a great location there. I wanted to ask you, SANA. There, explain the name.
I know. It's very hard to come up with a name. So I, it was honestly a last ditch effort. I looked up words in Latin and in Latin, apparently sauna means like healthy or to heal. So, and I like the sound of it.
I
So
love that.
like fancy. So
I
that was
love
where we
that.
ended up.
Um, I love that. I was wondering that. I was like, is it an acronym for something or is it, oh, I like it. It's Latin and calming, which I love. I love it. All right. I want to ask you one last question, which is adapted. Do you know who Lewis Howes is?
I'm not familiar, no.
He's a podcaster and
Okay.
he runs a podcast called The School of Greatness. And he ends every podcast with this question that he calls the three truths. Okay. And he's interviewed billionaires. And I just love the philosophy of this question. So it goes like this. It is, imagine it's the end of your life, however you get to pick the day, however long away it is. And you've written all your books and you've done all your videos and you've done everything you want to do. But for some reason, you have to take all of that with you. And before you go, they give you a piece of paper and a pen, and you're allowed to write down three things that you know to be true. What are your three truths?
Oh, that is a good question.
Uh,
Interesting.
and it's hard, so take your time with
Yeah.
it.
Well, one comes quickly that family is everything and just simple. Treat them well, they treat you well, and they're the most important.
Yep,
And then I think that time is equally as important as you get older. Do that thing that you would have said no to. Make time for things.
love that.
Third one, oh gosh. You're stronger than you think you are, I think, because I didn't think I could start my clinic by myself, and I surprised myself and I did it and I'm enjoying it. And so far is somewhat successful. So I think
I
that
love that. Family is everything. Appreciate your time, and you're stronger than you think. Um, that's great. I love those. Yeah, I hadn't. I like to leave that one as a surprise.
yeah,
Put
that
us on the
you
spot.
threw me there.
I
Oh
know.
gosh.
I
Huh.
know. Okay. I always end this with a couple rapid fires just to get to know you guys a little bit, and so the audience can get to know you. So, what is your most used emoji?
I am old, so probably just a laughing face. Huh.
Your favorite pizza topping?
Pepperoni.
Dream vacation spot?
Greece, where you got married.
Yeah. Have you ever been?
No, I want to go definitely.
You gotta go. It's awesome. Yeah, I'll tell you again. I'll tell you that story off camera.
Yeah.
Your favorite local restaurant?
Dough. Really
Oh
like,
yeah, right here. Gosh, they used to be right up the street from you. You could have walked there.
yeah. I
They
do
got a
like
little
their
developed.
new, like the ambiance at the new one though.
Yeah, it's a cool spot. They got a good outdoor space there.
Yeah,
How do you take your coffee?
I do tea.
Tea. How do you take your tea?
The Starbucks just like iced black tea, plain. Very
Really?
simple. Yeah.
Simple lady. I love that. Favorite movie?
A couple of the usual, no. Shawshank Redemption, I think I
That's
would
a
say.
great
I
movie.
love that movie.
That's a great movie. Mountains or beach?
Beach, definitely.
Do you go down the shore?
Yes, yeah.
Uh, yeah, I was Jersey born and raised, and I think there's no better place than the Jersey Shore.
Yeah. Cape May
Um,
is my favorite. Or
where?
anywhere, but Cape May we go every year.
Oh, I love that. Yeah,
Yeah.
yeah, you can't beat it. Okay, and then last one is give me one word to describe you.
Yeah, that's harder than the three questions. Ah, go. Oh, goodness gracious. Hesitant? I don't
Hopefully.
know. Uh,
Maybe how might your friends describe you?
easygoing, I think, probably.
Yeah. Yeah. I haven't known you that long, but seems accurate. I love it. Well, thank you again for being on here. I really appreciate your time and what you do for our community and the athletes and the people who in our community and how you serve them. So I just want to acknowledge that it is really hard to go out and start your own thing, and I admire you because I know you had another time in your career where you were a staff PT, and we talked about it before, but you pick your heart. So I just want to say thank you for taking your time, which is so precious and valuable, to talk with me and get to know, allow our community to get to know you.
Yes, thank you very much. Yeah, it was great